Hey there, this is Dr. Linda Burke, board certified OBGYN physician blogger and author of the prenatal book, The Smart Mother's Guide to a Better Pregnancy. So this is the month of November, which is Diabetes Awareness Month, and I just want to talk briefly about diabetes, specifically as it affects pregnancy. So 2 to 10% of pregnant women will develop diabetes during the course of their pregnancy. Why? Because insulin, which is produced by our pancreas, doesn't work as well when women are pregnant, specifically or particularly when they reach the 24 to 28 week mark, because there is a hormone produced by the placenta that counteracts what insulin does. So insulin has to work harder, the pancreas rather has to work harder and harder to produce more insulin to counteract this hormone called HPL that's produced by the placenta. How are pregnant women diagnosed? Usually every pregnant woman should have a 1-hour glucose test between 24 to 28 weeks. If you've been pregnant before and you had gestational diabetes, then you should have the test done a little earlier, around 24 to 25 weeks. If this is your first pregnancy, then 28 weeks is usually the time that you do this 1-hour test called a glucose challenge test. And basically you drink a syrupy drink, and then 1 hour later the blood is drawn. Now, here's a thing I want to let everybody know. The cutoff for that test is usually between 135 to 140. And you as a pregnant mom need to know what your numbers are, because they're very, very important. Also, this talk is helpful for women who are not presently pregnant but might be contemplating becoming pregnant in the future. This is helpful information for you as well. So if that 1-hour glucose test is over 135 to 140, then you have to get a second test. And that test is called a 3-hour test. And, you know, it's not the nicest thing in the world, but if that second test is also abnormal, then you definitely have gestational diabetes, which has to be treated. Now, I just want to point out something about that 1-hour test. If that 1-hour sugar test is 200, you don't need the 3-hour test, okay? The diagnosis has been made, and there's danger if someone tries to give you a 3-hour test with the glucose challenge test is 200, because that can cause a condition called DKA, diabetic ketoacidosis. Basically means that, you know, you get very sick and sometimes you might develop a coma. So you don't want anyone to give you a 3-hour test if your number is 200, or even if it's 195, that's close enough to 200. And I bring this up because sometimes, you know, physicians, midwives make mistakes in terms of managing a pregnant woman like that. Why is diabetes so important in pregnancy? Well, because it can cause harm. Stillbirths are a huge risk factor if you have uncontrolled diabetes. The other problem is that the baby can get too big, and then you run the risk of needing a C-section. There's also a condition called shoulder dystocia, meaning that, you know, diabetic babies have very broad shoulders, and when it's time for the baby to be born, the head is delivered, but then, you know, sometimes there are problems in terms of delivering the shoulders. So these are the reasons why diabetes in pregnancy is very, very high risk and needs to be managed appropriately. Now, the other thing I want to talk about briefly is, if you do have gestational diabetes, if the diagnosis has been made, you need to be seen by a physician, okay? There are some centers, clinics that refer you to, you know, refer pregnant moms with gestational diabetes they send them to nutritionists, nurse nutritionists, or dietitians. And that's all well and good because glucose control, you know, essentially depends upon your diet. But because there are these risk factors that I've talked about, you need to be managed also by a physician, either a maternal fetal medicine specialist who takes care of high-risk pregnancies, or an obstetrician who is well trained in terms of managing diabetes. But for you to be managed only by a dietitian during pregnancy is not the standard of care. So I hope that this discussion has been helpful. You know, this is not a master class in gestational diabetes, although, shameless plug, I am offering courses in the future that are going to address these topics. My book, Smart Mother's Guide, also addresses gestational diabetes. But this is just a brief discussion to give you some idea about why managing gestational diabetes is important. If you enjoyed this discussion, please share the love and look forward to speaking to you again soon. Thank you for listening.